Dear student, our lecture is about immunodeficiency diseases. We have many learning objectives for this lecture. We are going to define what is immunodeficiency diseases and what makes an individual immunocompromised, and classify the immunodeficiency disease as primary and secondary, and identify the most common primary and secondary immunodeficiency disorders. And we are going to discuss a clinical case example and laboratory investigations for immunodeficiencies disorders, and define what is the SPIR. What is immunodeficiency? It's a state in which the immune system is unable to respond appropriately and effectively to infectious microorganisms. What makes an individual immunocompromised? There are many factors that cause defect immunity. First, congenital intrinsic factor, that's mean primary immunodeficiency, includes single gene disorder, يعني يكون one gene are defect in one gene, or mutated single gene, polygenic, that's mean many genes are mutated, or HLA polymorphisms. Second, acquired, that means secondary immunodeficiency, as a result of diseases or conditions affecting immune component. The primary immunodeficiency is classified according to which immune component is defective. Humoral, that's mean B cell, might be defect in B cell, cellular, T cell, or other cells of immune system. Combined, that means cellular plus humoral are the defect in those component of immune system, or phagocytes, defect in complement, one complement component, or many component. Examples of congenital immunodeficiency: B cell deficiencies, infantile agammaglobulinemia, Bruton's syndrome. Here there are pure B cell deficiency syndrome, con B cell here defect in B cell, X-linked, يعني defect in chromosome X due to lack of tyrosine kinase, which results in failure of B cell development and few or absent B cell count with low immunoglobulin level. هنا إذا عدنا absent B cell معناتها no immunoglobulins، بنسوي laboratory test ما عندنا immunoglobulins، while إذا few B cell count عندنا low immunoglobulins levels. Patient presented with repeated biogenic infections. As you know, in bacteriology lectures, you have already knew what is biogenic infection, bacterial infection. Now I IgA deficiency. The most common immunodeficiency is IgA deficiency. Very low IgA level with normal B cell count. بنسوي البي cell count it's normal but level of IgA is very low in those kind of patients. Some have recurrent infections, especially of the sinuses and lungs, caused by biogenic bacteria. تكون anti-IgA antibody can be detected in about 1/3 of the patient. ممكن 1/3 of patient تشوف عندهم ممكن anti-IgA antibody in the lab tests. Now T-cell deficiencies, thymic aplasia, DiGeorge syndrome, تكون severe viral, fungal and protozoal infections occur early in life. تكون بما انه T-cell deficiency عندهم تكون عندهم ممكن viral infection, fungal and protozoal infection earlier in their life. تكون frequent infection episodes دائما تجيلهم نوبات الانفكشن frequent متكررة و absence of T cells while B cells have normal count but defective function. Here there are no T cells in those patients but the B cells count is normal لكن defect in the function of B cell. Why this happen in those patients? As we know, there is interaction between T and B cell. T cell will activate B cell in order to activate, proliferate, differentiate and antibody production. إذا إحنا ما عندنا هذا الأكتيفيشن من التي سيل للبي سيل أكيد sure البي سيل راح يصير defective function in that case. Now hyper IgM syndrome. This syndrome is characterized by low levels of IgG, IgA and IgD in association to a marked elevation of IgM. يعني احنا بنسوي lab test for levels to investigate the levels of IgG, IgA, IgD. We are going to find that levels مالتهم very low levels, while in comparison with IgM level, IgM is very high level in that patient. T helper T cell have a defect in the surface protein اللي هو CD40 ligand that interact with CD40 on the B cell surface. Here ال T cell helper T cell عندها فد surface marker اللي هو CD40 ligand اللي will bind يرتبط with CD40 receptors, specific receptors نسميه CD40 on B cell surface. When binding CD40 ligand with CD40 receptor on B cell, it will activate B cell in that case. لكن بما انه احنا T helper defect عندها in that surface protein اللي هو CD40 ligand ما راح يكون activation تحفيز للبي cells. This results from inability of B cell to switch from the production of IgM to other classes. يعني الكلاس switching هنا can be defect شو نعني بالكلاس سويتشنج؟ يعني البي سيل هي تنتج produce IgM first IgD and then class switching، يعني تسوي switch، تبدي تنتج other classes IgG IgA according to the infection then type of infection. هنا اكو ديفكت بالكلاس سويتشنج مال بي سيل نتيجة انه اكو فد ديفكت بالسيرفرز بروتين CD4 T ligand اللي موجود on T cell. Okay. Now the combined immunodeficiency. Severe combined immunodeficiency disease SCID said that's mean the defect in humoral and cellular immunity بالB والT cells. Recurrent in those patients نشوف recurrent infection caused by bacteria, viruses, fungi and protozoa occurs in early infancy, nearly 3 months in their life. يبدي recurrent infection بهذه الage مالت patients. تكون deficiency in both B and T cell function. It's inherited disease تكون inherited طبعا due to defect. As we said, it's congenital disease due to defect in differentiation of an early stem cell. Defect differentiation of stem cell راح يسوينا defect deficiency both B and T cell functions in that case. Now the complement component deficiencies. ممكن there are defects in complement component in one component or many component, more than one. It leads to defect or the immunodeficiency disease. مثلا عندنا CD3 ممكن إذا defect B ممكن تصير عندنا defect recurrent bacterial infection in those patients. مثلا إذا عندنا بالC1 C2 بالC4 ممكن immune complex disease يصير عندنا. ممكن إذا D factor B factor proper D factor defect بيهم هذول ممكن يؤدون إلى recurrent Neisseria infection or bacterial infection. مثلا عندنا defect يكون من C5 to C9 يعني C5 C6 7 8 9 راح يصير عندنا recurrent Neisseria infection bacterial infection. As you know, in complement lecture, I think you remember that من C5 إلى C9 راح يكونون arranged on bacterial cell membrane ويصير polymer of C9 يعني راح يترتبون على شكل محدد والC9 راح يتكرر as polymer ويسوون على شكل pores يسببون pores on bacterial cell membrane. ليش؟ لأن يصير فالديفكت الازموزية مال البكتيريا راح تصير بيها ديفكت فراح يصير destruction الماك formation membrane attacked complex نسميه. هنا إذا أكو فد خلل all these component or one of these component ما راح يصير الماك formation membrane attacked complex على cell membrane of bacterial cell فما راح يصير destruction للبكتيريال cell. ممكن يصير leads to recurrent Neisseria infection infection, bacterial infection in that case. In C1 inhibitor deficiency إذا أكو deficiency بالC1 inhibitor راح يصير angioedema in those patients. Phagocyte deficiencies, like one example, chronic granulomatous disease. The presentation مع patient with phagocyte deficiencies يكون prolonged and recurrent infections the skin and mucous membranes بسببها دايما ulcers, osteomyelitis, sepsis, deep abscesses, and commonly staphylococcus infection. Staphylococcal اللي هي catalyst positive infection يكون عندهم those types of patient. Invasive aspergillosis ممكن inflammatory problems وgranuloma يكون عندهم formation. أتصور you remember granuloma from pathology lectures. عندكم فد lecture concerned about granuloma, how granuloma form and the structure of granuloma. The presentation of patients with chronic granulomatous disease CGD يكون skin infection, عندهم ممكن primary aspergillosis يعني تتميز بالهالو ساينز مثل بالسكان سكانينج من تبين باللانج يكون عندهم هالو ساينز. ما I'm not going to go through this in details لأن راح تاخذوها in medicine lecture. الصور الكل سامعين ديفيد فيتر The Boy in the Bubble، الفتى اللي عاش فقاعة بيت بلاستيكي because he has this kind of immunodeficiency disease. He lived from 1971 till 1984. Now the secondary acquired immunodeficiency. First, immunodeficiency caused by drugs. ممكن drugs تسبب لنا secondary immunodeficiency. Drugs causing neutropenia تكون neutrophil count less than 500 microliter. It predisposed to severe infections caused by biogenic bacteria and inter-gram-negative rods ممكن تسبب هذه types of immunodeficiency. راح تسبب لنا يعني من تصير الدراكس تسبب لنا قلة النيوتروفيل يكون low count راح ممكن result in severe infections ممكن تسببها biogenic bacteria and inter-gram negative rod. يتهيأ البيشنت لهذه الانفكشن بهذه الحالة لأن neutrophil count is very low. cytotoxic drugs مثل بالكانسر كيموثيرابي هي تسبب لنا immunodeficiency بهذه الحالة. immunosuppressive drugs بالautoimmune disease سبب لنا acquired immunodeficiency. corticosteroids also cause acquired immunodeficiency. Now immunodeficiency caused by infection. عندنا many infection cause immunodeficiency بهذه الحالة. مثلا in patients with AIDS الhuman immunodeficiency virus ال HIV alters T cell immunity راح يأثرن على T cell and allows further infection with opportunistic pathogen راح يسبب لنا opportunistic infection بالباثوجين اللي هي تكون تستغل الضعف بالimmunity وتسبب infection. Certain bacteria release toxins مثلا that function as super antigen. مثلا البكتيريا اللي عندها super antigen ما راح I'm not going to go through this in details because you already know from bacteriology lectures. هذه ممكن تسبب لنا immunodeficiency. ممكن other causes of immunodeficiency مثل renal failure, diabetes, malnutrition, liver failure. ممكن all these cause secondary immunodeficiency. Now we have a clinical case example of Proteins disease. راح أسوي له analysis لهذه الكيس. مثلا إن شاء الله in future you will be a doctor and you have a patient with these signs and symptoms and how to analyze this case. We have 12-month-old boy with 4 episodes of severe gram-positive bacterial pneumonia in the last 6 months. Had recurrent diarrhea. الميكروب اكتشفناه باللاب هو جارديا. His tonsils are barely detectable. Below the norm of high and weight. Recommended pediatric immunization. عنده low IgG and low B cells. Has 3 healthy sisters, aged 3, 5, 7 years. The family lost a boy at 10 months of age due to bacterial pneumonia 8 years ago. Now look at the age 12 months and how frequent episodes مالته 4 episodes معناته frequent. severe معناته severity هي severe episodes. Which microbes and gram-positive bacterial infection. When that's happened in the last 6 months. Now he had recurrent diarrhea and the lab investigations showed the microbe is Giardia and his tonsils are barely detectable. يعني من الصعوبة انه تحسون بيها when you examine his tonsil. He is below the norm for high and weight. يكون يعني failure to grow. عنده failure بالgrowth مالته ما واصل معدل normal. recommended pediatric immunization يعني يكون من سووا له lab tests شافوا low IgG low B cells فلازم يحتاج immunization بهذه الحالة. has 3 healthy sisters. لما سألوا parents شكد عندكم أولاد قالوا عندنا 3 healthy sisters اللي هم age 3, 5 and 7 years ما بيهم أي شيء. لكن we lost a boy at 10 months due to bacterial pneumonia 8 years ago. لما سألون الفاميلي history مالته يقولون عندنا a boy also died from recurrent bacterial pneumonia. okay. هذه راح تعطيكم دلائل انه هذه الكيس مالتكم هي immunodeficient patient might be protein disease. Okay. Now for a laboratory investigation of immunodeficiency, we have many tests for humoral antibody immunity, IgG, IgA, IgM, plus minus IgE, subclasses of IgG from 1 to 4, levels to specific previous vaccines, level of IgG مثلا, according to the vaccination اللي ماخذ patients. مثلا عندنا test for cell mediated immunity, lymphocyte count, lymphocyte subset analysis مثل CD4, CD8, T cell, NK cell, B cells, الماركرز panels, in vitro test of T cell function. هاي كل هالتيستات ممكن نسويها للبيشنتس. تيست الفاغوسيتيك سيل مثلا، neutrophil function, for complement ممكن نسوي له test, specific tests. But we have definite tests. مثلا molecular testing. بالmolecular ممكن نسوي genes, genetic testing, و see the gene mutation, detection of gene mutation in that patient. Now, infections suggesting underlying immune deficiency defined as SPUR. SPUR. S means severe, persistent, unusual, recurrent. يعني patient when presented with severe infection, persistent infection, unusual infection, and recurrent infection, that's just this patient is immunodeficiency patient. Okay, now we finished our lecture. Any questions? Any question you can ask via the classroom, Google Classroom, via Telegram, or I'm ready to answer it. Thank you.